and welcome to For Your Health. I'm Mark Crosby. Thank you for joining us for this particular program. This program explores various health issues, concerns, and helps you to stay informed. Joining me, as in programs past, is Nurse Caitlin Pico from the Quincy Health Department. Caitlin, welcome back.
Thank you. Thank you for having me back.
Always a pleasure. Always a lot of information, no matter what topic you discuss. Today, we will be talking about type 2 diabetes prevention.
Yes, and this is a very big topic, so we'll kind of just briefly go over key points to it and what to monitor for, because there's a lot of people in the general public who could be at risk and they're unaware of what they should be monitoring for. So it's very important to know.
Very good. And we will start with an outline, so you know what to expect, and I guess I know what to expect. We will start with the definition. So what is type 2 diabetes? We will talk about prediabetes, risk factors, symptoms, testing, complications, and prevention. I did that all without my glasses.
Very impressive.
But that's thanks to you for actually giving this to me at a font size that is easily readable. So thank you.
Of course.
So let's start with the definition. So what is type 2 diabetes?
Yes, so all of this information that I got today, I did get off the CDC, which is the Center for Disease Control and Prevention. So according to the CDC, diabetes is a chronic health condition that affects how your body turns food into energy. So if you think of the average healthy individual who does not have diabetes, the body breaks down the food into glucose, otherwise known as sugar. And when that is broken down into sugar, it is released into the bloodstream, which increases your blood sugar levels. This increase in the blood sugar would then signal to the pancreas to release insulin, which enables the body's cells to use the glucose as energy. So with an individual with type 2 diabetes, this individual has insulin resistance. So this is where the cells do not respond normally to the insulin that is being produced. So the pancreas, over time, it tries to continue to produce insulin to counteract the high blood sugars, but it eventually cannot keep up, and therefore the blood sugar levels continue to rise. And according to the CDC, more than 37 million Americans have diabetes. And approximately 90 to 95% of those individuals have this type 2 diabetes.
And that's what you are talking about. What you just talked about was type 2, not type 1.
Yeah, so this whole episode is regarding prevention of type 2 diabetes. Type 1 diabetes is relatively the same, where you would have, it's either your body does not produce that insulin or there could be some resistance. The risk factors for type 1 diabetes are a little bit more unknown, and there's not really prevention for type 1 diabetes. But there is for type 2, so that's the information I was hoping to express.
Very good. We will, I guess, move now to the risk factors.
Quickly before we get to risk factors, I just wanted to mention prediabetes, because that's another word that's thrown out there as far as diagnosis. So prediabetes is a serious health condition where you again have blood sugar levels that are higher than normal. But at this stage, they're not quite high enough for a diagnosis of type 2 diabetes. So another fact from the CDC, approximately 96 million American adults have prediabetes, and 1 in 3 of those individuals are not aware that they have prediabetes. So at this stage of prediabetes, lifestyle changes are extremely important in preventing the progression to type 2 diabetes. So we'll go a little bit into that once the different levels as we go into this episode.
I guess one of well, something that comes to mind as we're talking about this is really stay in touch with your primary care.
Yes, and with any chronic illness, it's a collaborative approach. With diabetes especially, there's a lot of different avenues. Of course, you need to stay in contact with your primary care doctor to ensure you're managing your blood sugar levels and taking your medicine appropriately. Where diabetes medications and management varies vastly between person to person. I didn't quite go into all of those avenues, but it is a chronic disease that people are dealing with every single day. So with diabetes especially, a lot of the management falls on that person specifically, because they're the ones that are eating, that are managing their medication. So it's a collaborative approach. It's not just you and your healthcare provider. It helps to have family and friends involved if you have someone close that can help. There are also counseling groups, and there's a lot of resources out there if somebody were to have type 2 diabetes, or if they thought that they may have pre-diabetes and they wanted to get some additional information.
So it's really all about management.
Yes. Yes.
And certainly with the numbers that you had given out earlier, there are a lot of people that have pre-diabetes and diabetes.
Yes.
Type 2.
Yes, and with the type 2 and the pre-diabetes, there are a lot of lifestyle changes that a person can implement in order to reduce their risk or better manage their blood sugar levels to make sure they don't get any complications.
Now we will turn to risk factors. I did jump ahead earlier. It's because I didn't have my outline in front of me. But now I'm back, hopefully on track.
Yes.
So let's talk about the risk factors. And we'll start with?
Yeah, so the risk factors for pre-diabetes and type 2 diabetes are basically the same, considering pre-diabetes can lead to type 2. But where we're talking about type 2 diabetes, people who are at risk include those that are diagnosed with the pre-diabetes. It could be individuals that are overweight. Tends to with age, so they say 45 years and older. That doesn't mean children can't get it, and we are seeing just with a lot of younger children, we are seeing it with the type 2 diabetes a lot earlier. There is also family history, sedentary lifestyle, so if you're very not active, they all kind of go hand in hand, because if you're not active and you have a poor diet, then it may lead to overweight, so it all kind of goes hand in hand. There may also be a history of gestational diabetes in your family. And then individuals that are at higher risk, different ethnicities. So we have African American, Hispanic or Latino, American Indian, Alaskan Native persons, Pacific Islanders, and Asian Americans can be at a higher risk to develop type 2 diabetes.
I was listening to a gentleman speak about, I believe it was about sleep and how to get a good night's sleep. And he was told it was just a general health information that he was sharing with folks while he was doing his presentation. And he was told that if you go and exercise, just take a walk after a meal, just a half-hour walk can benefit your body greatly. So it just leads to one of the risk factors you had talked about, and that was the overweight issue.
Yes, and a lot of time, like the food, especially nowadays, like there's so many over-processed foods that we eat in America.
Not you personally.
I'm guilty of it here and there. I try to eat
So
a
am
little
I.
better. Everybody could be a little better at that. But it really, what you are nourishing your body with, you're going to see the outcome. If you're not nourishing your body appropriately, getting enough rest, getting enough nutrition, you are going to see health effects like such as type 2 diabetes. So it's all very important, and it all goes hand in hand.
So let's talk now, if we could, about symptoms. So type 2 diabetes symptoms.
Yeah, so a lot of times when your blood sugar is really high, this is where you're getting these symptoms. So individuals may see increased urination, especially at night, increased thirst, increased hunger. Some people may see weight loss without trying, which is very concerning, so make sure you check in with a doctor. They may have blurred vision, numbness or tingling in your hands or feet, fatigue, dry skin, poor wound healing, and more infections than normal because it can weaken your immune system because your body is dealing with a chronic illness, so it's not going to be as strong at fighting off infections. It is also very important to know that some individuals don't have any symptoms at all, and that kind of goes hand in hand with why so many Americans may not notice that they actually have prediabetes or type 2 diabetes. So it's very important to know these symptoms and I always say almost on every episode, make sure you're keeping up with your annual checkups with your primary care doctor.
So where would this show up in an annual checkup? Would it show up in blood work?
Yeah, so it would be, and actually next we'll get into the testing that they do. A lot of times, depending, your physician will look at your risk factors if you fall into any of those categories. And typically with your annual checkups, they will do lab results to kind of see your baseline and where you fall on the pre-diabetes to type 2 diabetes scale.
Okay, so now we will be talking about testing.
Yeah, so testing. So to confirm either this is type 1, type 2, and pre-diabetes, I just went through 4 basic tests that you typically would see. The first one is the A1C test, and this measures the average blood sugar level over the previous 2 to 3 months period. So that's a very important test because it kind of gives you a long-term look. It's not just that present day, you're actually looking in the past 2 to 3 months what your blood sugar levels were and how they peaked or how they dropped. We also will see the fasting blood sugar. So this means that they would measure your blood sugar when you were fasting overnight. Therefore, you had no food overnight for a certain amount of hours. If you were to get this test, I would just check in with your doctor to see what they recommend, how many hours to stop eating prior. There's also a glucose tolerance test, and this will measure your blood sugar before and after you drink a liquid that contains glucose. So you would see this a lot of like in pregnancy, they'll do this test to see if the mother has gestational diabetes. And then there's also that random blood sugar test, which that just means there's no fasting. You're just taking your blood sugar to see what it is at that time. With this testing, you can do, I've seen like a simple finger prick where they just test it right there and you put it into the glucometer and it'll tell you right there. Some diabetics that are insulin dependent, they have to check their blood sugar level each time to give themselves their insulin. So it's very important to know those different testing and to get education from your doctor, because a lot of times if you are diagnosed, you're at home testing yourself. There's not somebody there to do it for you. And just with this, I wanted to bring up an image. It's called The Road to Type 2 Diabetes. I found this image on the CDC website, but it was sourced from the American Diabetes Association. So both of those sites are very good resources to find different resources in your community. But as you can see on this graph, they have the differences between diabetes, pre-diabetes, and then normal levels. So there's just the different, like, so an average person, their A1C test would be below 5.7%. As you can see with pre-diabetes, it goes 5.7 to 6.4. And then diabetes, it would be 6.5 and above. So you just kind of, with this graph, it's important because you can kind of see how those levels increase and what stage they would diagnose you at. But I would always say, any questions with the interpretation, talk to your primary care doctor, because they would work with you individually to see what you should do about these different levels.
You mentioned pregnancy, and for a woman that is about to give birth, she could experience diabetes, but it would be limited, correct?
Yeah, so it all depends on the person, but some people won't have any. They will be, they'll have no diagnosis. If they have a family history or any of those risk factors, they always will test people in pregnancy to see if they have gestational diabetes.
Gestational.
Yes. So for some individuals, though, you can, after the pregnancy, you can still have diabetes, and your doctor would work with you to see your treatment plan. Some individuals have the baby and then they go back to normal and don't need medication, but it's very dependent on that person, their lifestyle, their eating habits, and all of that.
The desk in front of you looks so clean, yet mine is not. Mine's quite the opposite. We'll see how controlled I am at this point. We will talk about complications from type 2 diabetes.
Yeah, so with diabetes, it's very important to manage your blood sugar levels. You don't want them dropping too low or rising too high. So some complications that you can see if it goes undiagnosed or if it's not managed. So the first one we have is heart disease or stroke. And this is because if you have diabetes and your blood sugar is really high, that would accelerate the development of clogged or hardened arteries. So it would lead to decreased blood flow. Oxygenated blood would not be able to flow as freely as it should. It also leads you, with that buildup, the clogged arteries, if that breaks off, it could lead to a blood clot, which can lead to like a heart attack or a stroke. So it's very important to manage your blood sugars before you get to the point where you do have cardiac complications. And that would be the same for kidney disease. You can lead to chronic kidney disease because over time, again, that high blood sugar damages the blood vessels in the kidney, so they can't work as well as they should. So many people with diabetes, you will see they will also have a diagnosis of high blood pressure. Because again, this diabetes is clogging your pores, your body is just not circulating as it should. So you will find with every single organ in your body can be affected. Many individuals will see nerve damage, vision damage, and this is important to know because diabetic retinopathy, so that is when it's a very common eye disease, and it is one of the leading causes of blindness for individuals. And this is because the vessels in your eye, in your retina, are being damaged because they're not getting the appropriate blood circulation. So many individuals with diabetes, if it's unmanaged, they can have even vision loss and blindness. So as we always say, you want to prevent prior to getting to this point. some individuals, they will have problems with their feet, with their oral health, with their hearing, and their mental health. We mentioned it briefly earlier, but it's important to know that this is a chronic illness that it's not easy to manage. There's so many lifestyle changes, a lot of doctor's appointments. It's not just your primary care. You have to keep up with your dentist, with your eye doctor. A nutritionist would be beneficial. So it's a very collaborative approach to manage diabetes.
But it is a manageable illness.
It is, but it's very hard. It's hard. So you got to think of it, having and dealing with a chronic dealing with a chronic illness affects your mental health, because that really inhibits your day-to-day life. Whereas people who are healthy, that might not have to think about testing their blood sugar, they can eat what they want. So it's a stressor. So it's important to know that it's not just managing diabetes. There can be depression and anxiety, and that goes with any illness.
Sure.
That can happen. So it's just important to know it's a collaborative approach. It's not easy, but that's why there are so many support groups and individuals out there to help each other, so you're not alone in the process.
Neuropathy, which is related to nerve damage, I would assume is a condition that one could get as well.
Yes, and you really got to think, I had mentioned like the tingling in your hands and feet. You got to think those are the furthest points from your heart. So if you are having this decreased blood flow due to blocked arteries, the blood flow is not circulating there, so you're going to get the numbness and tingling. If you get a wound, it can be very hard to manage. So that's another specialist that's important for diabetics, is a podiatrist. Because if you get a small cut on your toe while cutting your toenails, that could lead to a major infection and even amputation in some situations, because your body is not able to heal itself as it would if you were healthy and had no pre-existing conditions.
When we talk about this next topic, I always say it's very important, because if you listen to this, then you might not get the illness or the disease anyway, and that's called, and the topic rather, or the area that we are talking about now, is prevention.
Yes, and this goes hand in hand. It kind of sounds silly because it's going off those risk factors and just telling you you need to address those risk factors. So one very important is weight loss, and that goes hand in hand with regular physical activity. You mentioned it a little bit earlier, and we mention it almost on every show. But when we say increased physical activity, we're not asking you to run a marathon. Even if you could incorporate a small walk. I know that's not easy for everybody to do, but there are even different things you can, if you're sitting in front of a TV, you can lift weights, or just do something, even if it's 10 minutes a day, just increase it slowly to build your strength. Because they say 150 minutes per week of exercise, so that could be 30-minute walk 5 times a day.
And that's what we talked about at the beginning of this program, just
Yes.
a 30-minute walk.
And it gets a little easier as the weather gets nicer. But walking, swimming, and weight training are very good things. And a lot of people with weight training, they're like, oh, I can't do that. But even light weights, repetition, is helpful, because then your body, even after you're done, your body is still burning calories because it is responding to that exercise you had just done. You also want to manage stress, have a healthy diet, which is choosing healthy carbohydrates, fiber-rich foods, fish, and good fats. You really want to avoid saturated fats, trans fats, cholesterol, and sodium.
Which really gets to, I guess it really gets down to reading the labels on food packaging.
Yeah, and there's just when you go to the supermarket now, there's so much on the shelves. You get a can of green beans and there's like 12 different options. I always say the American Heart Association has a check that they put on different products that they deem healthier. So that would be whether they're like lower sodium and so forth. So keep an eye out for those check marks. Fresh is not always better, simply because if I were to buy a pound of fresh green beans but I'm not going to go through it, it's a waste of money. Whereas the frozen might have a little bit less, but if that's going to work for my my budget and all of that, I'm actually going to eat those and they're going to stay fresher longer, definitely go with that. So there's a lot out there. Just read your labels, and definitely just work with your healthcare team. Reach out to your local Board of Health if you don't know where the resources are in your community, because a lot of times we can either look it up quickly or we may just already know of different resources in the area, because it can get lonely if you're trying to manage this on your own.
Absolutely. But as you had mentioned, so many people are dealing with this or prediabetes, so are dealing with either type 1 or type 2 or prediabetes, that you're really not alone.
You're not alone. There's a lot of people out there.
And a lot of support groups.
And a lot of support. We even, at our job, sometimes will have seniors come in that like can't get in touch with their doctor and they just want to make sure they're doing the glucometer right. So reach out to your local Board of Health, reach out to your primary care doctor if you have concerns. And if you believe you have these risk factors and you don't believe you've checked in, call your doctor and say that you're looking to see where you fall right now and you're hoping to just use preventative measures to prevent yourself from developing type 2 diabetes and the additional complications that may come with it.
Well said. On that note, I think we will end this program. I want to thank you for coming in and sharing your knowledge with me and with the folks at home.
Absolutely. Thank you so much for having me. And again, I just wanted to say the CDC and the Diabetes Association are very great resources. A lot of times you can put in your zip code and they pull up all the resources around you. So definitely take a look at those sites if there are any questions.
Very good. And of course, watch this program again.
Yes, of course.
Right. Thank you so much.
Thank you.
And thank you at home for watching. And just please remember to support the local access TV station in the town, city, county in which you reside. Thank you.